Assalamualaikum warahmatullahi wabarakatuh. Hi, good morning. For today, I will present the task 1 for Gerontology subject PhD 554. My name is Azri Bin Izhar, okay, and I will be presenting on the geriatric symptom of incontinence. Okay, let's get going. Okay, what is the background? The world population is aging quickly. There are currently 703 million individuals over 65, and by 2050, that figure is expected to rise to 1.5 billion. Older adults classification by WHO determines that 65 years old is older adult, while the UN said that people who are 60 years old as older adults. Urinary incontinence is a common condition in the general population, especially the older adults, which reduce their quality of life. What is urinary incontinence? According to the International Association of Urinary Incontinence, any involuntary leakage of urine is called urinary incontinence. The prevalence of urinary incontinence is, in European nations, 37% of people have urinary incontinence, while studies in various parts of Asia estimated that 13% of older persons had urinary incontinence, and in Africa is as much as 45.3%. Research in Malaysia in the year 2019 shows that the prevalence of urinary incontinence was 16% and 23% among older women living in urban and rural areas. Risk of incontinence is lower among Chinese compared to Malay older women living in urban areas. Within rural population, respondents with chronic constipation were found to be at higher risk of urinary incontinence. What are the signs of symptoms of urinary incontinence or UI? First is looking urine during everyday activities. Second, being unable to hold in urine after feeling a sudden strong urge to urinate. Third, leaking urine without any warning of urge. Next, being unable to reach toilet in time, wetting bed during sleep, and lastly, leaking urine during sexual activity. So what happened during incontinence? Okay, understanding normal bladder anatomy and physiology may help with the understanding of this problem. The bladder is made of many layers of smooth muscle that creates a holding space for urine. The kidney filter waste from the body and send the remaining fluid through the ureters into the bladder. The bladder has stretch receptors that signal the brain when it is full and needed to be emptied. In normal person, inhibitory fibers allow the person to hold the urine. When it's time to void, the detrusor muscle contract and the sphincter will be relaxed, thus allowing urine to flow out. In UI patient, age-related changes may happen to the anatomy, which is decreased bladder capacity or feeling fullness, decreased detrusor muscle contraction rate, decreased pelvic floor muscle strength, and increased residual urine volume. There are several types of urinary incontinence. Okay, so let's go one by one. First one is stress urinary incontinence. Stress incontinence is urine leakage caused by increased intra-abdominal pressure brought on by activities such as exercise or coughing. This incontinence is caused by ineffective urethra. Secondly is the urgency incontinence, which refers to leak as you feel a sudden intense urge to pee or soon afterwards. It is due to the loss of anatomical support and often referred to as overactive bladder. You can also have stress and urgent incontinence together, which is called mixed incontinence. Next one is reflex incontinence, which is urine leaks without warning or urge, usually happen to the nerve damage to the bladder. Next is overflow incontinence, which bladders doesn't empty all the way, causing too much urine to stay in the bladder. Later on, due to the storage of the urine or the accumulation of urine, lead to leaks because the bladder becomes too full. Okay, next one is functional incontinence, which is due to physical disability or barrier, or problems speaking or thinking prevent from reaching the toilet in time. For example, patient with Alzheimer, when they feel the urge to go to urinate, but they somehow cannot process how is the normal process of urinating. So he or she will have trouble going to the toilet to urinate. And another example is, for example, arthritic patient where they have trouble to move their clothes in time to pass urine. So that is called functional incontinence. Lastly is temporary or transient incontinence. This is due to incontinence that lasts a short time due to a temporary situation such as medicational effect or having illness. Okay, let's go to the next one. Risk factors of incontinence. Number one is age. As we know, incontinence are highly increased with age. Second is gender. Incontinence are more common in female compared to males. Stress incontinence and urgent incontinence are more prevalent in female. This may occur during pregnancy or after menopause. Thirdly, if you have certain health conditions, for example, multiple history of pregnancy, if you are diabetic, if you are demented, and also obesity due to the increased size of adipose tissue, which put more pressure to our urinary tract system. Okay, the burden of incontinence to the geriatric population. There are three impacts of this condition, which is physical, mental, and social. Physically, incontinence can lead to pressure sore, can lead to sleep disturbance, can lead to urinary tract infection, and lastly, the risk of fall. Okay, risk of fall is one of the most common cause of death for people above 65 years old. Next one, due to unable to control their urge to urinate, may lead to anxiety and depression as they felt not confident to meet the outside world because they might feel that they will lose their face when they goes outside. Thirdly, their social work, their social life will definitely be impacted. They, are, they cannot work as normal, they can't travel as normal, they can't participate or they may be afraid to participate in physical exercise or maybe in doing their sexual function as they afraid uh, the episode of urinating will be present. So overall, we can say that socially, their quality of life is definitely affected. Okay, next, let's go to the physiotherapy role. Okay, for physiotherapy role, and active physical exercise and behavioral intervention is important in managing incontinence. However, patient program need to be individually tailored, taking into account patient mobility, motivation, and cognitive competence. Okay, first, let's go to the first major part of physiotherapy role, which is through physical exercise. The most important physical exercise to manage incontinence is by teaching Kegel exercise, which target the pelvic floor muscle. For example, okay, so how can we instruct patient to contract the pelvic floor muscle? Instructions such as try to hold their urine or imagine how to stop the flow of the urine can be helpful. Okay, next is to incorporate biofeedback while doing pelvic floor exercise. Okay, biofeedback provide patient with feedback on their muscle tone and is intended to improve the patient's ability to perform pelvic muscle exercise. Next one, we can also teach relaxation technique. Okay, this relaxation technique will help to urge or to manage the urge to urinate for the patient. One of the technique of relaxation technique is via the diaphragmatic breathing technique. Okay, the second part of physiotherapy role in managing incontinence is by giving bladder training. Okay, bladder training goals are to increase the amount of time between bladder emptying and the amount of fluid that bladder can hold. Approach in the sense of conditioning of behaviors and delaying strategies. A bladder training requires following a fixed voiding schedule, whether or not the urge to urinate is present. So, for example, if the person have the urge to urinate before the intended time, he or she can use the delaying strategy. For example, such as relaxation technique and doing pelvic floor exercise. As success is achieved, the interval is lengthened. For example, once patient is able to void urine, urine able to void, able to hold their urine for 30 seconds, then we will increase their voiding of urine duration up to 1 hour, up to 2 hours, and eventually up to 3 to 4 hours. Keeps a diary of your bladder activity, so we can see the improvement of how much you can hold and how long the duration that you can hold the urine. To conclude, elderly adults frequently experience urinary incontinence as a symptom of reduced bladder function, which places a significant strain on the patient and their social surrounding. Given the high pervasiveness of urinary incontinence around the world, well-being strategy producers should consider and indicative measures that focus on treatment and rehabilitation exercise. Here are the references that I use in doing this task 1. Okay, with that, I have come to the end of my presentation. In this opportunity, I would like to wish everyone Selamat Hari Raya Aidilfitri. Be safe on your journeys, and may all of our good deeds in Ramadan be accepted and be healthy, and also have a merry Aidilfitri. Okay, that's all from me. Thank you very much.